fixed out at a local bar with a cheap microphone and an old guitar. Cheap microphone and an old guitar. Cheap microphone and an old guitar. I'm fixed out at a local bar with a cheap microphone and an old guitar. Oh, I know, never, no. Oh, it helps to soothe my soul.
A good Tuesday morning to you, and welcome to Real Talk. I'm Ryan Jespersen, and we're thrilled to have you here at 8:30. Coming up in just a couple minutes, we're going to talk to Emmy Award-winning ESPN anchor Jen Latta, who's going to join us. A great football story over the weekend with Sarah Fuller making history for Vanderbilt on Saturday. We've been keeping an eye on a few pretty inspiring stories here, and we're going to be getting to those a little bit later on in the broadcast. Andrea Woo is also going to join us from the Globe and Mail. We're going to take a look at what Vancouver City Council did, what it's been discussing under the leadership of Mayor Kennedy Stewart on the decriminalization file. Vancouver's City Council making a unanimous decision to essentially ask the federal government for an exemption to federal law when it comes to drug possession. We're going to dig into that today. We're going to talk about the opioid crisis. We're going to take a look at public health and public trust in health delivery. That's coming up with Doctors Hakique Virani and Elaine Hyshka coming up in the 9 o'clock hour. Plus, my brother's going to join us today from Vancouver. Kyle Jespersen, a program director at InSite, which has been leading the way in Canada when it comes to supervised consumption services on Vancouver's downtown east side for the better part of 20 years. Kyle's going to join us right around 10 o'clock today, and we've got a whole lot of ground to cover. So we'll be taking a look at, of course, the fiscal update from the federal government yesterday by way of Deputy Prime Minister Chrystia Freeland, her first in that role, and the first real quasi-budget that we've seen from the federal government really since COVID began. And so we're going to get to some of those details. It's a record-setting deficit. It's a mind-boggling deficit. If you were to pull this outside of the context of COVID-19 and see a federal deficit of $381 billion, you'd have synapses misfiring and you'd have smoke coming out of your ears and you wouldn't be able to process it. It would not compute. But of course, these are different times, completely different times. And so we'll take a look at what that means for Canadians, what it means for you, where the government's placing its priorities. That announcement made yesterday afternoon after we went off the air here on Real Talk. You know who's keeping us on the air? One of our sponsors that we're so grateful for is our presenting sponsor. It's Bitcoin Solutions. And every morning off the top of the show, we're proud to say good morning to you on their behalf. They're a local company based out of Edmonton, but they have Bitcoin Solutions ATMs all across Canada. So if you're looking to safely and with confidence, and by the way, easily buy or sell Bitcoin, if you want to get into the cryptocurrency game, but you have questions, you don't know much about it, all you know is they're writing about it on Bloomberg, and some of the big American investors, the high-profile ones, are starting to get on board, including Jack Dorsey from Twitter. Check out Bitcoin Solutions. You can visit the sponsors link on our website, ryanjespersen.com, and learn more there about Bitcoin Solutions. Sam, let's get her going.
Real Talk starts now. Here's Ryan Jespersen.
We're going to be talking to Jen Latta from ESPN coming up in just a couple of minutes. Want to talk to her about the story of Sarah Fuller, an accomplished soccer player who made history as one of the women breaking barriers in sport for Vanderbilt on Saturday. Jen's covering that for ESPN. That's where she's an Emmy award-winning anchor That story is coming up in just a few minutes. We're also going to take a look at the announcement from the federal government yesterday. Sam, would you tee up that video for me? Deputy Prime Minister, Canada's Finance Minister, Chrystia Freeland, yesterday in delivering this fiscal update, a detailed fiscal update that was her first in this role. And there's obviously a lot to get into. A $381 billion deficit. That's what the government's looking at. And of course, all of this leading up to a more robust budget you would expect. This is Deputy PM. This is Canada's Finance Minister, Chrystia Freeland, yesterday.
I say this both as a working mother and as a finance minister. Canada will not be truly competitive until all Canadian women have access to the affordable childcare we need to support our participation in our country's workforce. Bravo.
Deputy PM Freeland there outlining one of the government's priorities. There's a fiscal stimulus package up to $100 billion involved in this. We're fixing things on the fly here. This is the intrepid Sam Brooks. Say hello, Sam, to everybody. We got a monitor here in front of me so I can see what we're talking about, but the monitor, of course, conking out as soon as we go on the air today. We don't sweat the small things here, do we, Sam?
You know, I'll take full responsibility for that one. I was testing some stuff yesterday, and I unplugged that monitor.
Well, there you go. That's why it didn't work. Well, now it's working, and I've got desktop, so I just need program feed, and we'll keep rolling here. A $100 billion fiscal stimulus package, including, And when you talk about a deficit of $380 billion, you start talking about a program that receives $1 billion, and it kind of sounds like peanuts in the grand scheme, but you have to think it's still a ton of dough. So $1 billion for improved ventilation and training staff at long-term care facilities. There's an example. Now, how far does $1 billion go across Canada? What does an improved ventilation package look like in one long-term care center? Probably a ton. So I'm sure that this isn't going to completely address the issue, but it indicates a priority from the federal government, I think, to respond to a lot of the criticism and concern that Canadians have about the security of our loved ones in long-term care centers. It's unprecedented spending from the federal government, to be sure, of course. And another big thing that I know people are going to be paying attention to is the wage subsidy. The wage subsidy has been boosted again here, back up to 75%, which I know that most people will assume, or at least have some hope, that this will allow employers, including small business owners, maybe like you, to keep their lights on. The most severe challenge that Canada has faced since the Second World War, said Deputy Prime Minister Chrystia Freeland yesterday in rolling this out. Loans for tourism and hospitality. We know the sector has been hammered. What sector hasn't been hammered? Unless you own Zoom or something like that. I think that most of the sectors have seen their struggles. Direct supports for arts and entertainment workers. That's another interesting one from the federal government. And rent relief for airports. Though nothing really laid out yesterday from the federal government when it comes to helping out the big airlines. So that's a point of interest, certainly, as well, to keep an eye on what the federal government will do for the big airlines. As of yesterday, by way of that fiscal update, nothing there. So that's something to keep an eye on as we move forward. We're also paying keen attention to what's going on provincially right now. The COVID numbers, Alberta, again, setting another record, not exactly the type of record you want to set, to say the very least. Alberta breaking, again, a single-day record for COVID infections yesterday with more than 1,700 active cases reported on Monday. 1,733 active cases reported on Monday. Another story that we're keeping an eye on this morning, and of course, just because we may not be discussing something right out of the gates, or just because our lead-off guest may not be touching on something, doesn't mean it's not on our radar. As of today, and by the way, welcome to December, everybody, on this December 1st, police in Alberta will be able to hand out what the government is calling stricter impaired driving penalties. Here's the thing. It's kind of a judge and jury at the roadside type situation. Impaired drivers, says the government, will be removed, taken off the streets immediately. This is through Safe Roads Alberta. It's a new adjudication branch. First time impaired driving charges are going to be handled quicker outside of court. The goal, obviously, to free up the courts. Impaired drivers could face larger fines and lose their vehicle up to 30 days. So this Safe Roads Alberta initiative will allow drivers to pay their fees online request more time to pay their tickets, or dispute their penalty or vehicle seizure. So that's something that we'll be keeping an eye on. Again, the government rolling that out. This goes into effect December 1st, and probably the most important thing we can all take from this is the obvious one, which is just don't drink and drive, right? We can all agree on that. Don't drink and drive, especially we get into the celebratory season. Though, Sam, I'm thinking that a lot of times when police talk about, holiday crackdowns for impaired driving or for check stops or those types of things, a lot of times they're talking about the holiday parties where, people are getting out of hand, people are drinking and driving. You have to wonder, and I hope this isn't coming across in some way as though I'm justifying that. I'm certainly not. I'm just saying I think that's why it happens more frequently. You have to wonder if de facto impaired driving incidents, let alone charges, are either dropping already or will be dropping as compared to last December's stats, considering where we're at with this pandemic, people staying in, people not socializing. I mean, is one of the flip sides that the roads are a little bit more safe?
I'm kind of in the point where, I'll take any positive the pandemic will give us at this point. Yeah, I mean, I think there's a pretty clear through line from one of those to the other that less Christmas parties means less impaired drivers. That doesn't mean they're going to disappear. And quite frankly, that doesn't mean people are not going to have Christmas parties. We know it's going to go on. We know there's going to be there's going to be some problems over the holiday season. But yeah, I totally agree with you is that, it's one thing I think that could be a real trap that we could fall into is, we announced this new government program to try and curb impaired driving. And we might end up with a situation of causation without correlation, right? Where the pandemic is what's actually keeping people off the road and actually keeping people from driving. But then, they get to thump their chest and say, hey, look at how amazingly this program worked. I'm not entirely sure if, the data that we get this year from it is going to be the most valid for assessing it for future use.
Yeah. Why don't we get to that tweet from the premiers? I was going to bring this up a little bit later, but it looks like Jen Latta might be having an issue connecting with us. The ESPN winning anchor out of Milwaukee, Wisconsin, covering college football, American college football. We hope to have Jen joining us in the next few minutes. If not, we're going to get to Andrea Woo from the Globe and Mail. Andrea has been covering the story of Vancouver City Council voting to decriminalize possession of drugs. Now, this includes or it essentially puts the impetus on the federal government, and Andrea will explain to us why, but the requirement is that the request essentially is that Vancouver exempt itself from federal policy. We're going to be talking to Liberal MP Nathaniel Erskine-Smith on Thursday morning here on the show. He'll be joining us live from Ottawa. This is something that he's been talking about for a long time. So where is the federal government's appetite on decriminalizing possession of all drugs? We'll talk about that coming up in 10 minutes with Andrea Woo. We'll talk about that on Thursday as well with Nathaniel Erskine-Smith. And, of course, we'll put that in front of Doctors Elaine Hyshka and Hakique Virani. They're coming up right around 9 o'clock, just after our quick break for the headlines. Take a look at this. This is something that a lot of people were talking about yesterday. I'm going to be honest with you. I hesitate to post stuff like this because this is the whole point of what this individual is endeavoring to accomplish with his tweets. This is the Premier of Alberta's Executive Director of Issues Management. The guy creates more issues than he could possibly manage. This is Matt Wolf discussing some of the coverage around these anti-mask rallies in Calgary over the weekend. Did you see this? People gathering to essentially, protest provincial directives, really pretty loose directives, but provincial directives on masks. Of course, nobody wearing masks. They're gathering in violation. The Premier's Executive Director of Issues Management, $200,000 a year for this. Quote, read some of the outrage tweets and stories on the weekend's protest. Keep in mind, this guy is messaging on behalf of the Premier of Alberta, right? And you've got hundreds of people gathering without masks. Think that the condemnation from the Premier's office during a pandemic might be aimed at the hundreds of people gathering without masks. But no, instead, Sam, can you pop that back up for me there for a second? The Premier's Executive Director of Issues Management decides to invoke from months ago the global phenomenon that were the Black Lives Matter rallies, the demonstrations, including in Edmonton, where about 15,000 people gathered at the Alberta legislature outside. It's a shit take, is what it is. He says substitute Black Lives Matter for anti-mask rallies, and he turns it into a political thing with lefties and liberals, and it really, I mean, myself as a white guy, I've got my own take on it. I can't even imagine how people of color feel about this. I can't even imagine how people that were out demonstrating as part of these Black Lives Matter rallies in response to, George Floyd being murdered in cold blood on camera by a police officer while in handcuffs crying for his mama. I can understand why people who would see centuries of oppression, including a legacy of slavery in the United States, and us Canadians aren't squeaky clean either on this file. I can see why some people might take issue with the top professional in the Premier's Issues Management Office deciding to, out of nowhere, nobody brought this up, nobody put this in front of them, nobody's talking about the Black Lives Matter rallies, but that's the direction that the Premier's office is taking yesterday. I'm curious to know what you make of that. Live streaming audio on Mixlr, or whether you're listening later in the day on our podcast, which, by the way, remains the #1 most downloaded podcast in Canada, 6 shows in. Today's show number 7, and we're so grateful for that. You can use that hashtag to talk to us through the live broadcast. You can also, of course, communicate with us using that hashtag later in the day, and we love to keep the conversations going. I mean, that's kind of the entire point, isn't it? We're going to talk to Andrea Woo in just a second. Sam, right now, why don't we say good morning to a brand new sponsor on the show? We're super excited. Today is December 1st, which means that we're really proud to be kicking off our partnership with Alta Storage. Now, here's the thing. Alta Storage, a locally owned company, they're pretty stoked to be part of this. They're telling us they wanted to join this journey. They said, we want to be in on the ground floor and watch this thing grow. And that's pretty exciting to hear from a sponsor like Alta Storage. You can check out what they're doing online at altastorage.ca. They've got those frog box things. So if you're considering a move and you want to do it in the most eco-friendly possible way, if you could use some storage solutions, maybe while you're doing a home reno or figuring out your space solution. I know for a lot of people, this pandemic has basically meant that they're reevaluating their entire living situation. They're reevaluating everything. Alta Storage has you covered. You can check out altastorage.ca for more on what they're doing. Sam, why don't we get right now to Andrea Woo? We're excited to have her joining us. Andrea is a health journalist for the Globe and Mail out of Vancouver, following a really interesting story. Under the leadership of Vancouver's Mayor Kennedy Stewart, City Council there voting unanimously to decriminalize possession of narcotics. But what does it actually mean? Andrea, kind enough to join us this morning. Andrea, I can see the clock here in our studio, 8:47 Mountain Time, which of course means it's not even 8 o'clock yet in Vancouver. We really appreciate you getting up nice and early to talk to us. Welcome to Real Talk. Thanks for joining the show.
Thanks so much for having me. This is one of the few times I've put on real clothes before noon.
Yeah. How is before we get into the story you're covering, how has your job and what you do for Canada's national newspaper, how has it changed through the course of the pandemic? I assume you're working from home. What else has been different for you?
Yeah, most of us have been working from home since March. It's just sort of been an onslaught of all the news that is terrible. Obviously, we can't be ignoring COVID right now, but we've seen that exacerbate other issues that have been quite substantial for years now, including the overdose crisis. So yeah, it's been a year.
We're going to be talking to addictions medicine specialist Dr. Hakique Virani and Dr. Elaine Hyshka from the U of A School of Public Health coming up in just about 15 minutes time. And then we're going to be learning a little bit more about InSite in Vancouver from my brother Kyle around 10 o'clock Mountain Time. He works there, Andrea. But from a journalist's perspective, can you bring us up to speed on where the opioid crisis is right now in Vancouver? We know we've seen numbers of overdoses, in particular in British Columbia and Alberta, but in British Columbia, really heartbreaking numbers. Where are those numbers at right now with regards to where they have been over the past few years? And what sort of a tangible impact can you tell that COVID, the pandemic, has been having on influencing those numbers either way?
Yeah, sure. It's no surprise that the numbers are very bad this year. In BC, we are, as of the end of October, we had something like 1,400 deaths. In Vancouver, it was 320 or so, and I believe it's already the second deadliest year for overdoses in the city. on record, and that's with 2 more months to go. It's been horrible. It's been absolutely horrible for years now. And what we have seen with the pandemic is that things have gotten even worse. One of the theories is that drug supply chains globally have been disrupted. For example, Wuhan, which was the epicenter and where the new coronavirus was first discovered, that was actually a major hub for fentanyl production. So that was locked down for 70-something days. People turned elsewhere. An already volatile drug supply became even more so. We saw extreme concentrations of fentanyl in postmortem tests here in BC. We're seeing more benzodiazepines. And then on top of that, because of COVID restrictions, we've also had things like social services be shuttered. Overdose prevention services in the city, your brother would know. In Vancouver Coastal Health, in any given week, we usually have around 6,000 visits. In the first wave, that dropped down to about 2,000. So more people were using alone, and then there are the harmful effects of isolation. It all just sort of comes together to create a really disastrous year for a lot of people, but for people who use drugs, it's particularly so.
I appreciate it, and I'm not surprised to hear you use, the preferred nomenclature, as they would say. People who use drugs. Andrea, I don't know about you, and I know that this is your beat. Essentially, you do a lot of work on the opioid crisis and on mental health for the Globe and Mail. But we can get so caught up, can't we, in numbers? And we're guilty of this as well, I think, when we're talking about COVID. These are people. You talk about people who use drugs. When you talk about statistics, it can be so cold. We have to remind ourselves the numbers are people with stories, people with promise, people with human value, people with families.
Yeah, I'm really glad that you say that. April 2016 was when our former provincial health officer, Perry Kendall, declared an emergency here in BC due to overdoses. It's been, close to 5 years since, and I think it's hard for people to feel that sense of urgency anymore when everything has gotten significantly worse. Progress feels excruciatingly slow, and we see record months after record months. And at some point you wonder if people are still registering, if people still care, if people are still recognizing that behind every one of these numbers is a person with families, with friends, with stories, and they're dying at, 5 people are dying in BC every day right now.
It's just when you put it that way, it's just hard to wrap your mind around. So let's talk about this step that Vancouver City Council has taken. I mean, it's obviously significant because it's got a lot of people talking. As far as I'm concerned, any major municipal center, I mean, the city the size of Vancouver, to see a unanimous vote on anything is somewhat remarkable, regardless of what it's about. But of course, some might also say, well, what does this really accomplish? Because it requires action from the federal government. Vancouver doesn't have the ability to unilaterally impose policy like this. Andrea, can you take us into this story?
Sure. So this was a motion put forward by our Mayor, Kennedy Stewart. Excuse me. The motion was to put a formal request into the Federal Minister of Health to grant an exemption from the Controlled Drugs and Substances Act to decriminalize possession of all illicit substances within the city. So that went to council last week. It was unanimously approved on, I believe, Wednesday. And so now they're in the process of drafting this letter to Minister Patty Hajdu, and then it will be over to her office to give the thumbs up or the thumbs down.
So this, we're going to be talking to Nathaniel Erskine-Smith on Thursday. This is something that the Ontario MP has been talking about for a long time. He's not in a position necessarily to I don't think, speak on behalf of the government here, whereas Minister Hajdu may. But what would be your prognostication here, Andrea? What sort of an appetite do you think the federal government might have for this. I mean, it certainly gives the federal government almost an opportunity to release a test balloon over Vancouver and kind of see how it flies, right?
Right. So the exemption that they're seeking is called the Section 56 exemption from the Act. And so under that, the Minister of Health can exempt any person or class of persons or controlled substance from the Act if she deems it necessary for medical or scientific purpose or it's otherwise in the public interest. We know that the federal government has repeatedly said that they will not decriminalize on a national level, but there are some indications that this could go favorably for Vancouver. Patty Hajdu's office, after Kennedy Stewart put forward this motion, said that they will work with Vancouver. They've been guided by advice from the Canadian Association of Chiefs of Police and the Public Prosecution Service of Canada. And those are notable because those are two bodies that have either said that they support decriminalization. The Public Prosecution Service has directed prosecutors in Canada to focus on more serious drug crimes, those that affect public safety, and to seek alternative measures for simple possession. So I think it's very notable that her office released such a statement. And there are some indications that she may give this the thumbs up.
Andrea, what's kind of the vibe on the street? Like how are Vancouver residents feeling about this? What are you picking up from? I mean, what are people talking about? I mean, it's probably tough to tell. I was going to say at the bars and the coffee shops, but I know that nobody's really hanging out like that. But what do you get as the general consensus, the public opinion on this? I
think I honestly feel like the tide is turning when it comes to discussions of drug policy. It's really sad that it's taken something like 19,000 deaths in Canada over 5 years for there to be meaningful discussion. But when this was introduced at council, there was a full day of speakers, and you heard from dozens of speakers who were overwhelmingly supportive of this. They recognize that, it doesn't mean that drugs are going to be free and legal and people aren't going to start using drugs because they're decriminalized. It's been very clear that this has not been working, that the criminalization of people who use drugs has created more harm. It's been ineffective. It's been costly. It's been really deadly in Vancouver and across Canada. So I think that there is some appetite for change.
Andrea, before we let you go, really appreciate your time. We're talking to Andrea Woo, who's a health journalist with Canada's national newspaper, the Globe and Mail. I know a lot of people look to your reporting for context on how British Columbia is doing with regards to the COVID-19 pandemic. Alberta's numbers have been off the charts per capita wise, about triple of Ontario's. Another new record, active infections, active cases in the province of Alberta yesterday, 1,733. One of the real concerns, we talked to an ICU physician, Dr. Darren Markland, last week, and then Dr. Shazma Mathani, an ER doctor, and both of them giving us a sense of what Alberta's real ICU capacity is. It's one thing to see the numbers of ventilators and beds we have, but as the doctors pointed out, if we don't have the doctors and nurses and respiratory technicians, et cetera, then those beds are virtually useless. Our ICU capacity estimated by these doctors around 200, and we've got about 100 Albertans in ICU right now due to COVID-19 alone. Medical professionals are starting to wave the red flag here. I'm not trying to induce panic, but maybe we need to a certain degree. What's the reality? What's the landscape in British Columbia?
Yeah, BC did relatively well during the first wave and quite well over the summer until midsummer or so. Right now, like much of the rest of the country, we're seeing a much rougher second wave. We had just over 40 people die over the weekend, which was a really jarring number. There were some regional restrictions that were introduced, and they were recently expanded to be province-wide. So I think everyone's just sort of waiting with bated breath in hopes that this will bend the curve down a little bit. but it's not too dissimilar from what we're seeing in other provinces right now.
Yeah. Andrea Woo, a health journalist at the Globe and Mail, with her work primarily focusing on substance use, mental health, and Canada's overdose crisis. You can give her a follow on Twitter at Andrea Woo. Thank you for waking up early for us. We really appreciate it, Andrea. Thanks for this.
Thanks so much for having me, Ryan.
You bet. We're going to get to news headlines coming up in just about a minute, but we want to thank another one of the partners that ensures that our journey is ready for launch. We're really grateful to the team at Park Power, your friendly local utilities provider, powering the Real Talk RJ hashtag. Every single show we do, they offer internet, electricity, and natural gas in Alberta, a different option than the large incumbent, the big traditional utility companies, the ones that Grandma and Grandpa used to pay every month. Park Power is doing it differently. Check out their social media. Check out their commitment to their communities. Check out how they share their profits with nonprofits right here in Alberta. They've been in business since 2013, and they've grown their business by offering low rates, awesome service, and again, that charitable profit sharing. You can learn more at parkpower.ca or check out the sponsors link at ryanjespersen.com. Before we get to doctors Elaine Hyshka and Hakique Virani, let's take a look at what's leading the headlines as we hit 9 o'clock on this Tuesday morning. As mentioned, Alberta breaking a single-day record for COVID-19 infections. That's 1,733 active cases reported on Monday. We also have an update by way of the federal government's finance minister, Deputy Prime Minister Chrystia Freeland yesterday, her first detailed fiscal update in that role as finance minister, the government's first real numbers since the start of the pandemic. Take a look at the federal deficit. Now, again, it's apples and oranges, but 2019-20, the federal government ran a deficit just under $40 billion, $39.4 billion. The projected deficit for 2020-21, $381 billion. So just under 1,000% increase, of course, in this COVID era. It includes the wage subsidy boosted again back up to 75%. Stimulus package worth about $100 billion, and rent relief for airports, but nothing yet for the major airlines. We're also keeping an eye on Alberta's new impaired driving laws that go into effect today through Safe Roads Alberta, which is a new adjudication branch. First-time impaired drivers, or at least those getting caught and charged for the first time, will be handled more quickly outside of court. Impaired drivers could face larger fines and lose their vehicle on the spot up to 30 days. And we'll have more on that in shows to come. All right, let's turn the page. It's a real pleasure. Sam, do we have both the good doctors set to go here? Awesome. I'm super excited about this. Doctors Hakique Virani and Elaine Hyshka have been widely recognized as experts in their field when it comes to public conversations about addictions medicine, drug policy, public health as well. And I'm really thrilled that on the heels of their piece in the Hill Times, we're going to talk about public trust in healthcare. As part of this conversation, they've co-written a piece that was published just a couple of days ago in the Hill Times. Also, obviously, informed voices on the opioid crisis, and we'll certainly talk about the decision, that vote from Vancouver's City Council. Let me get them on camera here as we extend a very warm welcome to doctors Elaine Hyshka and Hakique Virani. Welcome to Real Talk, and thank you for making time for us today.
Hey, Ryan, thank you, and congratulations on the show.
Thank you. Dr. Hyshka, I'm not sure if you had a chance to hear Andrea Woo. She was on just before the two of you, a health journalist with the Globe and Mail, but I talked to her at length about Vancouver City Council's recent vote, which is an interesting one, also about the opioid crisis, Canada's overdose crisis, and the impact that COVID has had on that. I know that this is something that you keep obviously a very keen eye on, and I know that public health in this context is basically what's driving your professional career to this point. Take us into your perspective on the overdose crisis right now in the era of COVID-19.
Thanks, Ryan, and it's great to be here, so thanks for having us. I think, yeah, it's really dismal is the best way to sum it up, the situation in Alberta right now. We don't have a lot of good data because the overdose reports have been slow to be released by the provincial government. But what we do know is that in the first half of this year, 449 people died of an overdose. And that's well and above the previous record, which was around, or by this time, which was around like 300. I have to take a look. But so it's like, a significant increase. when you talk to people on the front lines, people that are working in supervised consumption services or doing outreach or working in the emergency departments, it's really just been catastrophic to see such a dramatic increase in overdose, and seeing way less support available in the community for people who are at risk of overdose. So whether that be limitations on supervised consumption services, less places to go if you're seeking support with housing or support with basic needs, all of that is adding up, and it's having a really serious impact. And I think, there's been a lot of speculation about what is driving that, and certainly we can't say 100% that we know, but all evidence is really pointing to the fact that the drugs that are in circulation right now are more toxic than they were before the pandemic. And that's because the pandemic has led to supply disruptions that are leading to new substances in circulation that are causing people to overdose at the worst rate we've ever seen.
So I'm not going to pretend like I know what I'm talking about here, really, but in layperson's terms, Dr. Hyshka, is it that availability of fentanyl or whatever else, that those that are, you can correct all my language. Sam, we got something weird going on here on our screen, but all of my language here is going to be, off. But people that are making the drugs, cooking them up, they don't have access to some of the things, some of the ingredients that they would typically have, so they're adding in other nefarious elements. They're cooking it with things that obviously pose greater problems to people's health, and then unsuspecting users are ingesting them. Have I in layperson's terms characterized what's going on?
Yeah, that's exactly right. So basically, the illegal market operates in the shadows. And so we don't have, full data on how it works, but we do know that borders, it's obviously very sensitive to border closures and disruptions in traffic over borders. And so what we're seeing is traditional supply lines have been disrupted, and people are scrambling to try to meet the high demand in the community for illegal opioids in particular, but other substances as well. And that's leading to all kinds of new mixtures in circulation. And so, for example, if you look at data out of BC, they're reporting in the toxicology that they're taking in postmortem, coroner's investigations, that the concentrations of fentanyl and other kind of novel synthetic opioids in people's blood is much higher than before the pandemic. And so, there's no quality control in the illegal market. People don't know what they're getting, and as a result, they're very, very, very high risk of overdose.
Dr. Virani, I want to kind of quickly run through your CV so people get a sense of what your professional experiences look like. That obviously fuels your perspective. But you're a clinical associate professor in the Faculty of Medicine at the University of Alberta. You're a specialist physician in public health and addiction medicine, and you also served as a medical officer of health for Health Canada for 10 years, including through the H1N1 influenza pandemic of 2009. So you've seen it all, so to speak, or at least you've seen a lot. What observations when you look back on your experiences as a medical officer of health through H1N1, and then 10 years later, you're able to evaluate statistics and anecdotal evidence and talk to real human beings about their experience through this pandemic, what are some of the parallels that you're noting, and what's different about this one 10 years later?
I think the thing that jumps out the most, Ryan, is that we don't learn very quickly from our experiences. And that's really heartbreaking. We had the benefit of a couple of, I would say, dress rehearsals in SARS and in H1N1 to get our act together. And we had the benefit of several really good commissions analyze our responses to H1N1 and to SARS, and give us advice about how we might do a better job when a bigger thing hits. This is the bigger thing, and we're not doing a better job. If we look to jurisdictions that have made changes, public health reforms in response to things like SARS or the Middle East respiratory syndrome in Eastern Asian countries, we see that those jurisdictions that have enshrined public health leadership independence have performed extremely well. Take Taiwan, for example, that has a central epidemic control arm of government that is arm's length from the rest of political government, and took the bull by the horns as soon as sounds of a new coronavirus came out. They're a population of about 25 million and have had 7 deaths. They've got Christmas. They're going to beaches. They're going to restaurants and bars because of a strong public health response at the outset, that was independent from political considerations, that protected the public, and they're reaping the rewards of that. We've not seen that kind of public health leadership in the COVID outbreak, and we have not seen that kind of public health leadership across most of the country with respect to overdoses, and that's tragic. I think one of the reasons why we see more of a press and more public outcry about the responses to the pandemic is because it's affecting a broader swath of people than the overdose crisis. And that too, I think, is tragic. By the end of this year, all told, we'll still have lost more people to overdoses in Alberta than we will have from COVID, although I catch myself as I say that because the numbers are going in the wrong direction.
Yeah.
On both.
Yeah, I'd hate to see you proven wrong, but I mean, either way, it's a disaster and it's devastating. Let me ask you, Dr. Virani and Dr. Hyshka as well. I want to kind of ask the question and then just get out of your way and let you get into this piece that you wrote for the Hill Times because it's powerful and there are a couple pretty strong assertions. And Dr. Virani, you hinted at it just there, talking about how the pandemic, there are politics of a pandemic, like it or not. And it takes on a different look or manifests itself differently based on the jurisdiction, whether you're talking about Hong Kong or Phoenix, Arizona, or Edmonton. But your piece in the Hill Times, the two of you co-writing it, public health is not dependable without independence. Dr. Hyshka, you first. I mean, let me leave the question vague and broad and wide open on purpose. Why is independence, or let me say arm's length from political influence, so important for trustworthy public health delivery?
Yeah, I think it's really key. Public health officials are trained to take into account a whole range of evidence and understand the different hazards that exist, that threaten population health. And so when we encounter a pandemic or another major threat to public health, when officials are formulating their responses, they're weighing all the different evidence. They're thinking about ensuring that whatever actions are taken are not disproportionately impacting, vulnerable populations or one segment of the population specifically. And the best way for them to move forward is in an environment where they can be free to speak openly about their recommendations, what the evidence says, what the evidence doesn't say, what we don't know for sure, and also to feel that they can they don't have to take into account political lenses, right? They don't need to worry about whether this will be popular or play well in one part of the province versus another part of the province. They don't have to worry about if this is ideologically aligned with the general approach that the government of the day is taking. They really just look at the evidence and they want to see what is going to strike the right balance in terms of saving lives, protecting health, and getting us through this significant crisis, And so when you have to layer over a political lens and you have to be accountable to elected officials, fully accountable, and you have to say your messaging has to be in line with government talking points, it really limits your ability to advise openly and transparently and steward us through a very, very challenging time.
Yeah, I thought it was powerful. It jumped off the page, and I don't know which of the two of you wrote this. I know co-authoring a piece can have its advantages and disadvantages. You got to kind of find a way to see eye to eye with your co-author, right? Because you're putting it down, and you both put your stamp on this. But you write, quote, premiers and ministers may perceive a choice between population life expectancy and political life expectancy. The pressure to appease political bases and the most influential can distract from the task of protecting the most vulnerable. Not exactly profound, and certainly true, and probably pretty troubling for people as that slowly washes over them, Dr. Virani.
Yeah. So this is my first occasion actually in so long of knowing her to co-author a piece with Dr. Hyshka, but that was my sentence.
I revised it.
Did you take away a bit of its punch power, Dr. Hyshka? Is that what happened?
I made it slightly less dramatic. I'm not gonna lie.
Okay.
Yeah, she did, but I think we both. we're both very concerned about how dramatic the results have been from the failure to enshrine public health independence in our system. And one of the most significant ways that I think it's affected the pandemic response is its impact on public trust. You know, the number of sacrifices that we're asking Canadians to make in the interest of the collective good is substantial. And, you know, we saw at the beginning of the pandemic that people were almost like soldiers in the way that they responded to the call for restrictions in the interest of the public health. And, but if we keep asking and we keep asking and we keep asking for more and more, but we don't tell people what we know, or they come to know things by accident, and then there's a whole big to-do about how to cover up the information that's come out, I don't think that's a position where we've earned public trust and where we've earned the right to continue to ask for those sacrifices. Now, don't get me wrong. I think those sacrifices are extremely important. But to demonstrate that we value the public's engagement, that we're invested in protecting their health, and that we're going to make good on the promise to protect public health when we ask for those sacrifices is really, really important, you know. And I think that I just wrote a Twitter thread yesterday about how it's peculiar to me that those governments who are using the, well, we're interested in protecting lives and livelihoods line, seem less likely to actually put their money where their mouth is. I don't think you'll find a public health expert in the country who doesn't support the idea of providing paid leave for people who are self-employed or who work essential services in grocery stores or public transportation and that sort of thing. And you won't find a public health expert in the country who doesn't believe that when we ask people to undertake disproportionate hardship in the interest of public health, that the collective owes a duty to them. If we ask a restaurant to stop in-house dining and it affects their bottom line, we need to be there for them to support them. And you know, with respect to teachers, if we're asking them to take on extraordinary risk, or grocery store workers taking extraordinary risk, there needs to be, I don't want to use the term hero pay, but that's the one that comes to mind. There needs to be a way to reflect that we understand the disproportionate burden that you're bearing. But we have to demonstrate that we value their contribution, and we need to demonstrate that we're trustworthy in what we're asking people to do, and that requires transparency. In politics, transparency, you know, the standard of transparency is different from what we hold ourselves to in medicine. Informed consent's a big deal for us when we ask for permission to do pretty invasive interventions.
So this is all great, and it's informed perspective that you bring, the two of you, and it all makes sense, and it sounds doable in theory, but you're also talking about politicians demonstrating transparency. You're talking about politicians surrendering power to a certain degree. You're talking about politicians putting faith and meaningful support behind science. All of these types of things that I hate to say it, but quite frankly, just aren't going to happen. So what is realistic? I mean, I hate to put it that way. Elaine, I know you kind of smirk because, you know, you and I have talked many times in many different capacities about public health and measures you'd like to see taken in policy that you know would have an immediate impact, but sometimes that policy feels miles away considering the political process and what has to happen. So what's realistic for people to expect of, you know, the Alberta government, the federal government? What would be on your, can I put it this way, holiday wish list?
Hakique, do you want to start maybe with the federal level and I can speak to the provincial?
Yeah, I mean, the first thing I would say in response, Ryan, is that this is actually in the politicians' best interest to remove themselves from front and center of the pandemic response. Because some of the impacts that we need to consider are longer term than when the next election is. And some politicians are in peculiar positions where even the unity of their own party or their own part of the political spectrum, it may be threatened by some actions that they need to take. And so some of them would prefer not to be saddled, I think, with the responsibility of those decisions. But one of the things that we've suggested as kind of a temporary measure before we deal with this public health lack of public health independence once and for all is that we suggested in the Hill Times paper to federal decision makers that they immediately establish an independent pandemic response observatory, which would be a place where you and your colleagues could go for consistent and regular, reliable information on public health advice and what recommendations are being suggested to all of the jurisdictions. A place that could evaluate and score the responses as they go along, and could be kind of the body that is referred to justify the public health measures that jurisdictions take, to kind of deflect the responsibility of taking some measures that some people may not agree with. And if they perform well, and if the observatory endorses their performance, you can expect that a public adherence to population health measures would be better.
Dr. Hyshka, you were talking about a provincial response. Do you want to take it from there, and then I'll follow up?
Yeah, like just to add to what Hakique's saying, like obviously we are in a bit of a conundrum now, and we have to, move swiftly and continue with the response as best we can. I think what the province could benefit from is increased transparency around data, and also the inputs that are going into informing the decisions of elected officials. So we've heard a lot that cabinet is encumbered with these very difficult decisions. And I agree, they are very difficult decisions around which restrictions to put in place, and weighing the different potential negative impacts of those restrictions, and the potential health benefits of those restrictions. So if cabinet is making these decisions and there is an emphasis on using evidence to make these decisions, then that evidence needs to be made public. We need to understand what the trade-offs are. I think that will increase public trust in the decisions that are being made, and it will certainly go a long way to convince people to adhere to those decisions. And so, we haven't seen modeling since the spring as to where our epidemic curve is heading, and that to me is extremely alarming. I don't think it's not going a long way to convince people that we need to take immediate action. I think if people could appreciate how dire the situation is, we might get more population buy-in to some of the measures that are being introduced.
Yeah, I mean,
I think there's other things that could happen.
Well, and you see, I mean, I know what resonates with me, and Doctor, you're alluding to this directly, is when I see a graph that just goes like this, which is what we're seeing right now with hospital admissions and ICU admissions. I mean, I remember, put it this way, when this show went on the air 7 shows ago, last Monday, Alberta's ICU admissions, COVID-related, were right around 60. I think they were 61. And now we're hearing numbers, and there's some numbers being released by Alberta's official opposition today, and I haven't had a chance to review them because we've been on the air. But Rachel Notley's putting them out there. I've seen other numbers that have ICU admissions around 100 to 120. So they've doubled in 7 shows. To put that into perspective, I mean, this is a red alert, isn't it?
Yeah, it's creeping up. Oh, sorry, go ahead.
I was just going to say, and we shouldn't be relying on, individual physicians who are working in a system to come forward with some of these numbers and to raise the alarm. Like, this is not a coordinated information campaign that the public can rely on. This is, bits and pieces of information that are leaking out. And I think that is really damaging to public trust and to understanding, where we should be going.
Yeah, it's a difficult position to put the public in, that they have to comb through social media and decide for themselves, decipher what's reliable information. But you're right, we're creeping up to that 100 number of ICU admissions just from COVID, and we've seen pictures of double bunking in ICUs, right, where you have 2 people in one ICU room. And even if we're able to find spaces to put people, there's the question of whether or not you have the requisite number of skilled staff, healthy enough, and enough in our capacity, in our surge capacity, to manage this load. So you used the phrase earlier, waving a red flag. I don't know how much brighter red this needs to be. It's a very, very, very concerning situation. Not to mention the impacts that it has on all other parts of the healthcare system and all other sectors, right? We have patients of my own who are at risk for fatal overdose, who they and their friends won't seek out care at hospitals after a non-fatal overdose, in spite of the fact that they may well need support. because they're frightened about whether or not they'll contract COVID, and also frightened about whether or not they'll just be turned away. As it is, it's a stigmatized population of people, and now there's even more disincentives to seek out care. And this is why pandemics are so important to manage, is because of the ripple effects it has on everything else.
Just to ask the two of you here live as we're doing this, do either of you have to pull shoot at 9:30, or can we carry our conversation to the second half hour? I want to respect your time today.
I'm good for a bit.
Elaine, are you cool to keep going for a bit? Okay, great. Because I don't want to rush this conversation, and I guess you talk, Hakique, you talk about people that would be hesitant to visit ERs or to report or to seek medical attention. These are like you said, human beings, people that would already be experiencing many barriers, perceived or otherwise, to receiving healthcare, proper healthcare. With the population so hyper-focused, and of course it's a good thing that we are, but with the population so aware of this pandemic and talking about COVID-19, there are many other significant issues, significant national conversations that need to be had, that demand to be had, that quite frankly are not being had. I mean, if you look back to less than a year ago and you talk about, for example, the Wet'suwet'en situation with elected versus hereditary chiefs and railway blockades in Canada, and talk about reconciliation. I mean, that feels like years ago. That was not years ago. And if you talk about, the opioid crisis, another example, a public health story of huge significance when we talk about the human loss, when we talk about these preventable deaths, when we talk about public policy that's lacking, all of these conversations to a certain degree. And I'm not necessarily saying in your academic or research or healthcare circles, but at least in the sense of public conversation, these have all been put on the back burner. What sort of an impact is that having, Dr. Virani?
I guess we would need to be watching to know what sort of an impact it's been having. And my concern is that we're not doing surveillance on, or at least not reporting on surveillance that's being done in those major areas. That concerns me. Of course, we have to be preoccupied with this pandemic, and it speaks to the need for us to have nipped it in the bud early on. As I said, in Taiwan, they're on the beach, and they're able to deal with other social issues that are important to them. I think some of the things that you raise come down to the way that we manage inequities, and that is a story inside this pandemic as well. We know that there are certain groups of people, age demographics, that are more vulnerable to this virus and are more vulnerable to so many other health conditions and adverse outcomes. There are racial groups who are at a more significant risk because of probably a variety of socioeconomic factors. We just heard yesterday that people in Northeast Calgary of South Asian origin, we just heard yesterday, 8 months into this pandemic in Alberta, that people in Northeast Calgary are at higher risk. Maybe it has something to do with the types of occupations that they're forced to go to, or the supports that are unavailable to them to participate in a public health response and protect themselves. I mean, these are all issues that continue to rear their ugly heads, whether it's in a pandemic, whether it's in an overdose crisis. And we just heard yesterday about the experience of Indigenous people of racism in the healthcare settings. So all of these things are huge matters that we need to be focusing attention on, and we just can't so long as we continue to see these numbers well into the thousands of active cases of COVID. Just yesterday, we hit 1 in every 265 people in Alberta has an active COVID infection. How on earth are we supposed to deal with the fact that we still probably have about 2 or more people dying from opioid overdose in this province? It's just a mess.
Elaine, where's your head at on that?
Yeah, I think, being a public health professor, it's incumbent on me to point out that when public health performs really well, and when it's resourced, and when, it's given independence, we tackle these issues head on. This is the bread and butter of public health. Of course, there's the field is committed to disease prevention, like in terms of like the, clean drinking water and all these like basic public health interventions. But more and more, especially in Canada and other similar societies, we're focused on preventing non-communicable disease. And so that's things like, diabetes, heart disease, substance use and mental health conditions. And those at their root are often driven by inequality. And so public health is very interested in understanding what are the health impacts of inequality and how can we address them as a society, and what are the benefits of doing that and what are the trade-offs. And so I think one way I'm hopeful about everything that's transpired is that I hope that people will recognize the potential for public health and for strong public health systems to identify these weaknesses in society and our social fabric, and to take action to address them. So the next time we have a whole society crisis, we're not so ill-equipped to protect people and to save lives. And so I think there's a lot of conversation that needs to happen, and I'm hopeful it will happen around protecting public health, enshrining minimum public health standards across the country. I think there's room for federal law reform to, just as we have the Canada Health Act that protects a basic, minimum set of medically necessary services for healthcare, we should have something similar for public health. And if we have that, we'll be so much better equipped to deal with acute crises issues and these long-term systemic and systematic issues that you raise, Ryan. And so I'm the forever optimist. I wouldn't be in this field if I wasn't an optimist. And I do hope really strongly that that Canada will reflect and will move forward on some systematic changes in this area and really shore up our public health resources, because there's so much potential to prevent illness and death and to promote everyone, to have as good a life and well-being as possible.
We're lucky that you are a perpetual optimist, Doctor. You restore our faith in humanity and give us reason to believe that we can do better. I want to ask both of you about health reform on the other side of this quick break we're going to take, because obviously in Canada, when you talk about healthcare delivery, you're talking about the feds and the provinces, which is a huge deal. Right? Provinces with their autonomy, et cetera. And we'll get back to that in just a second. I want to say thank you to our sponsors this morning at St. Albert and Sherwood Dodge. This team, Scott and his teams in St. Albert, that brand new Dodge dealership, and Sherwood Park as well, have prided themselves in the relationship that they have with their loyal customers, from the point of sale all the way through to the long-term service relationship. They are Alberta's biggest Jeep dealers, and if you're looking to upgrade your ride to make sure that you're well equipped to get around in this Western Canadian winter, check out the 2020 Grand Cherokee. I'm loving driving one of those right now from St. Albert Dodge. They've got a ton of them at Sherwood Dodge as well. Make sure you see them, and you can link to their website under the sponsors tab at ryanjespersen.com. We'll get back to Drs. Virani and Hyshka in just a moment. Sam, let's take a look at the headlines here. Well, you heard it at 9 o'clock here on the show. Alberta again yesterday breaking a single-day record for COVID infections, 1,733 active cases reporting on Monday, as Alberta's ICU numbers continue to rise as well. Yesterday, we heard from Deputy Prime Minister and Finance Minister Chrystia Freeland, her first detailed fiscal update, the government's first since the start of the pandemic, hers the first as Finmin, as they call it, as finance minister. The government forecasting a $381 billion deficit. This update ahead of a budget, which will give Canadians more of an idea of what the federal government's plan is. They talked about supporting frontline workers, low-income earners, students, women. A lot of priorities outlined, of course, as part of this big $100 billion fiscal stimulus package. Rent relief for airports, for those interested. I know a lot of people are keeping an eye on the aviation industry, wondering what's that going to look like in a year from now. Nothing yet for the big airlines, though the federal government continues to negotiate with them. And today, December 1st, Alberta rolling out new impaired driving laws. Police will be able to hand out stricter impaired driving penalties roadside to get impaired drivers off the street immediately. The move expected to clear up the courts. The stronger impaired driver penalties include fines up to $2,000, immediate vehicle seizures up to 30 days, and mandatory ignition interlock for repeat offenders. That announced by the provincial government today. We're talking to public health professor Dr. Elaine Hyshka, and we're talking to a man who certainly has seen it all. I keep saying seen it all, Hakique, Dr. Virani, as medical officer of health, but at least you saw a whole bunch, including H1N1, serving that role for 10 years, and now in your role with addictions medicine and certainly on the front lines of this as well. Why don't we start with you, Dr. Virani? We talk about reforming the healthcare system, and I want to ask the two of you about Vancouver Council's move in just a moment. That's an interesting one, I think, in a case study that Canadians will be watching. But with so much talk about healthcare, we really get into the weeds on it, right? I found it difficult to even have meaningful public conversations about healthcare because so many people start talking about bloated middle management and waste and structure of healthcare delivery between the feds and the provinces, and it's such a massive machine. You know, it's like trying to turn around the Titanic. Bad example, maybe, or maybe it fits. But how do you actually start to, I mean, is this something that the public has to make an election issue as an example? How do you actually, people watching or listening right now or later on the podcast, how do you impact meaningful change? What can people do?
Oh, wow. I don't know the answer to that, Ryan. I would have thought that, the expert commissions that we've had in the times that public health and healthcare have made major mistakes would have had an impact in the way that we move forward, and they've not. I guess, like the answer to so many questions of public endeavor, the more that people know, the better that they're informed, the more sophisticated our asks can be. And the harder we can hold our elected officials' feet to the fire. But, I think one of the challenges that we have, and one of the reasons why probably Elaine and I are both happy to be on your show, is that, we need to be able to tease out real information from not real information. Democratization of knowledge is a really important thing. I believe that. But unfortunately, a lot of folks get their information from places where it's not reputable. You've always made a point of asking that experts speak to issues that experts ought to speak to. But how you decide whether or not a suggested healthcare reform or a suggested healthcare problem is real shouldn't depend on how many Twitter followers somebody has. And so we really do, it's a false argument that all big decisions have to be made by elected officials and they must be popular with the majority. In our civil society, we do depend on unelected institutions of civil society that make independent decisions in the interest of the collective good while considering the needs of minority groups amongst us. And I think that it being a more engaged civil society would probably go a long way to solving some of these issues.
Yeah, and you know what, I've sort of thought, and by the way, isn't it interesting? Isn't it kind of sad? Isn't it kind of an indictment on our entire communication or media landscape when a show like this is getting credit from people on Twitter, is being celebrated by people on Twitter because we talk to experts about subjects that matter? People are acting like we're breaking the mold here because we're getting expert opinions on matters of public health. I mean, that to me is, I guess we're happy to take the recognition, but it's kind of discouraging, quite frankly.
Well, to be fair to your colleagues, Ryan, I think one of the great things about your new show is that you can dive deeply into these issues, and you did that before as well. But to hear for example, at the COVID pressers, the updates and briefings, it's the same few reporters who have to deal with those issues. You spoke to Andrea Woo; she's covering COVID and the overdose epidemic.
Yeah,
it's a tough job to go deep on these issues for journalists nowadays. And so I think it behooves the public to try and look for good information themselves.
I just want to jump in there too, though, because I want to just make it clear that I don't think Hakique or I would say that, the only experts are people with medical degrees or with PhDs or with, credentials. And I think, Ryan, I've listened to you for a long time when, in your previous life and now your new endeavor. And you've always been really good about having people whose lives are directly impacted by the issues on air. And I know you've had in the past people who use drugs, or someone who uses supervised consumption service. And it is so critical to hear those voices, to have meaningful engagement with people with lived experience of the issue at hand. And I just think that that goes a real long way in understanding the potentially unintended consequences of some policies or different government actions, and also in identifying what are the most effective solutions. And, in public health and in health promotion, that is a central tenet of how we operate, is that we engage the population that's impacted to understand the issue and to devise solutions together. And I think that will strengthen public health responses, whether it be for a pandemic or the overdose epidemic. And so, in our work, we're trying to reform the healthcare system to be better for people who are struggling with substance use issues. And we don't do anything without consulting with people who use drugs first and getting their insights. And I think it's not just about consulting them and hearing their expertise, it's also about empowering them to make the changes themselves. Like, there's nothing more powerful than having a patient with a negative experience talk to a set of healthcare providers and explain what happened and why it impacted them. That is how we make change. And decision makers at all levels need to be in touch with people with lived experience and to hear their stories. And it's just, you can't underestimate how powerful that is. And so I think that is a key to achieving broader health reform, is to give a platform for those voices.
Yeah, I remember
the Vancouver decriminalization motion from City Council is a great example of what Elaine just described. The voices of people who use drugs was instrumental in pushing City Council to that decision. And one of their champion legal societies was also critical to coming up with a decent motion. And there were some whereases in that motion that were just spectacular in the way that they reflected the real experience of people who lived the downside of poor drug policy.
Let's get into that story. I mean, that quite frankly, here's what we're just figuring out what this show can be in these conversations, and people are telling us, our audience is telling us, they're loving these long form conversations. And I'm chuckling because it's now 9:40, which means it's been about 37 minutes since we started talking, and now we're going to get to the subject that I asked you to come talk about here on the show 37 minutes into the interview. But as mentioned, we talked to Andrea Woo, who really does an incredible job, and she's achieved national renown, well deserved, as a health journalist with the Globe and Mail. She lives and works in Vancouver, and she's been following the story of Vancouver City Council. Tomorrow it'll be a week since they voted unanimously to decriminalize the possession of small amounts of drugs within city limits. This is following years of public debate about this. We're going to be talking to Liberal MP Nathaniel Erskine-Smith on Thursday about this. He's been talking about this for years. Vancouver's Mayor Kennedy Stewart says it's time to develop what he calls a health-focused solution and end the stigma around drug use. Of course, the city of Vancouver will still need this to be approved by Ottawa. They're seeking an exemption, and then they'll process how the decriminalization will be implemented. Dr. Hyshka, why don't we come to you first on this? What is this? I mean, I suspect that you've got probably a pretty strong opinion on whether or not this is a good move or not. Take us into what you're making of this and whether or not you think that this could be a case study that could maybe apply to some sort of a national policy or national federal legislation.
Yeah, and I apologize because I didn't hear Andrea, so I don't want to, accidentally repeat what's already been said. But I think really critically, public health is in agreement that this is the way to go. Like, we know that the evidence shows criminalizing individual possession is not effective for deterring substance use, if that's the aim, but it is really effective for increasing the harms of that substance use. And so whether that be in terms of increasing overdose risk, increasing risk of HIV or hepatitis C, there's a whole host of negative outcomes related to substance use that are exacerbated when people are at risk of criminal sanction. And so it's not controversial in our field. I think the people that study substance use and drug policy, especially in Canada, are in alignment on this. We've seen, the chief medical officer of health for Toronto, or the lead public health officer there, endorse it as well. The Board of Health, I think, endorsed decriminalization there. It's frankly long overdue. Even the Canadian Association of Chiefs of Police are supporting it. So my question is, why haven't we seen it yet? I can appreciate, again, this is where the politics and public health intersect. We have a minority parliament. This is still a controversial issue amongst the general public. And so We haven't seen the federal government move forward with broad reform here. I think what Vancouver is doing, though, is providing them a middle option. Instead of just not acting or acting and reforming the law across the country, it's saying try decriminalization here in our city, see how it goes, monitor the impacts. And I think that that could provide a really important case study for moving forward with broader policy reform here. And I think that would just, if we look at where we invest our money when we address substance use, we invested in policing and jails. That is where the vast majority of resources go. Even when we say that we support a health approach, this is not a criminal issue, it's a health issue. We have politicians, everyone likes to say that, chiefs of police like to say that, but at the end of the day, the money is still going to criminal justice. And I think a real move in the right direction is to stop enforcing hundreds and thousands of charges against people for criminal possession in the country, and to put the resources that we would spend doing that into the healthcare sector to properly address substance use issues when they arise.
Dr. Virani, just in plain language, why do you think the concept of what Vancouver's council is pursuing here is so unpalatable to some people? Is it the idea that if you decriminalize narcotics possession, that it's going to be a free for all, that 11-year-olds are going to be shooting up on the schoolyards, that everyone that has never been inclined to try methamphetamines before is all of a sudden going to be burying their face in them? I mean, what in plain language, what's behind the public hesitation?
I think that's probably some of it. And what you're speaking to is the unfamiliarity that people have with people who use drugs. My suggestion would be meet somebody. Because most Canadians use some psychoactive substance, whether it's alcohol or cannabis, or whether it's a drug that's currently illegal. Most Canadians do. And I think that when people envision a person who uses drugs, they think of somebody who really, the characteristics that they're uncomfortable with is more along the lines of they're poor, or they come from a racial group that you've not been familiar with. That there's differences there that you are uncomfortable with. And I think that underlies a lot of our apprehensions about so many policy issues, is not so much whether the policy suggested works or not, but how comfortable you are with the people that it applies to. And that, I think, is a bigger problem that we ought to deal with. Is we're at a time where everybody's life literally depends on each other. So we should take that to heart and recognize that we're connected. And when somebody's harmed by a policy that is fundamentally unjust, we all ought to stand up and demand change. To me, it's interesting that the places where harm reduction measures are most accepted, or where drug policy change is most popular, are those places that are familiar or have become more familiar with those ways of thinking, right? In Vancouver, since InSite opened, the apprehensions about supervised consumption have gone down, not up. And I would hope that the same will happen in Edmonton, that the more familiar people are with the benefits of these interventions or the benefits of these public health approaches, the less apprehension there is about them. And similarly, it should be for decriminalization. There's a narrative that's extremely powerful about how traumatic police encounters can be for especially some racial groups. And to recognize how many of those encounters have something to do with the possession of drugs for personal use, we have to come to the conclusion that the removal of that interaction is really, really important. Elaine talked about how criminal drug laws are not a deterrent to people taking up drug use. And she said correctly that they are a way to enhance the harms that occur that are related to drug use. And one of those harms is encounters with police.
And it's, you take a look at, and even to broaden our conversation, and I don't know if either of you have an opinion on this or not, but I've had really interesting conversations with sex trade workers that have gone so far as traveling to Ottawa to lobby the House of Commons to consider completely and dramatically transforming Canada's laws with regards to the sex trade. And I mean, that's another conversation where I think if you put it in in front of the general population, or I mean, even if people are having this conversation with their friends, and you talk about things like decriminalizing possession of all drugs or legalizing the sex trade, decriminalizing the sex trade, et cetera, for a lot of people, it's almost a non-starter, or there's inherent pushback just because it goes against the way that it's always been, and there's kind of a fear of the unknown of what it might look like. I mean, to even look back a couple of years ago to October 17th, what was it, 2018, I think, when Canada essentially legalized cannabis, and you look, I mean, it was like Y2K style panic. From a lot of people that thought these kind of stoned zombies were going to be wandering around the streets, and there's going to be secondhand smoke polluting all the open spaces. And really, I would humbly suggest that aside from the prominence of cannabis retail shops, absolutely nothing has changed.
Yeah, I think that's a fair characterization. The sky didn't fall, you're right. What did happen, though, is interestingly, a large proportion of the people and organizations capitalizing on cannabis legalization were supporters of those who believed in criminalizing cannabis. And so that's, to me, is very peculiar. It's similar to, people using civil liberties arguments to justify not following public health restrictions are often the same people who say that people shouldn't be allowed to use illegal drugs. Taking one civil liberty actually affects other people, not wearing a mask, gathering in mass settings, whereas somebody using cannabis on their own in a way that doesn't hurt them is not imposing on somebody else's right to security of person. So I think we have to be reflective about our positions on these things. And supporting drug decriminalization does not mean endorsing drug use. I don't use drugs at all. I don't even drink alcohol, but this is a really important, I think, social justice and human rights issue and those are things that we say we believe in this country. So we ought to show it.
Yeah, Hakique, as a personal friend of yours, I've known you now for several years. That was the dumbest I've ever felt in your presence when, after both of us participated in a lively forum about addiction treatment and public health, I invited you to go out for beers with me. At which point you pointed out that you don't consume alcohol. I thought, oh boy, that was a little bit awkward.
I feel bad. I thought I might have made you feel dumber some other time.
Well, no. I mean, I feel dumb every time I talk to the two of you, only because it reiterates how smart you are. It reiterates how smart you are, and I learn something every single time. I can tell by his body language that the producer of this show, Sam Brooks, am I picking? Do you have a question for? Why don't we go to Dr. Hyshka first? I don't even know what you want to ask, but Sam, patch yourself in.
Yeah, sure. I've been intently listening, and also just decriminalization and sort of the harm reduction approach is something that I've personally really believed in for years, and I find this this is a fascinating story, and good on you, Vancouver. My question is, what do we do next? And I say this because we talk about decriminalization gets drugs out of the criminal justice system and into the healthcare system, where we can help addicts recover and we can help people move on with their addictions and seek treatment, but that also needs to be paired with a safe supply. We still have so much fentanyl on the streets, and I'm wondering, now that we have the legal framework in place, how do we fix the supply problem?
That's a great question. So I would say we actually, even with decriminalization, wouldn't have the legal framework in place to fully support the concept of safe supply. Right now, what we're seeing is across the country, the federal government has invested in a number of different pilots where they have small programs that are connecting people who use drugs and are dependent on the illegal market to access those drugs to pharmaceutical grade alternatives. And so basically the principle there is simple. When you use illegal drugs, you don't know what you're getting. They're very high, we know that drugs in Canada right now are very toxic. If you choose to use drugs and you're using a pharmaceutical grade alternative, you do know what you're getting, you do know the dose, and you're able to manage your risk a lot better. So those programs are rolling out across the country. They're not rolling out in Alberta. The provincial government has been very clear here that that's not something they want to do. And I find that unfortunately regrettable, because I think it can't be overstated how severe the overdose epidemic is. And, just when we thought it couldn't get worse, COVID happened, and now it is so much worse. And so if we want to get out of this situation, we need to be willing to try new approaches, to evaluate those approaches, and to innovate. And, no matter how much money we throw at the traditional treatment system, like residential treatment or, medications, those will only ever appeal to a subset of the population of people that are using drugs right now. And so if we want to cut down on deaths and we want to prevent family and friends from grieving those losses, we really need to be willing to innovate and try new things. And so I'm hopeful that as more experience becomes known, and as there's more experience with safer supply programs in other parts of the country, that the provincial government will reconsider that position, because I think it is something that's very promising. Decrim alone will definitely not reduce overdose deaths. Like, it will encourage people to be more open talking about their substance use. It may encourage more people to seek help and to seek out healthcare for their substance use. But at the end of the day, unless we can get people out of the illegal market and connect them to safer pharmaceutical alternatives, I think we'll continue to see overdoses. And I just add to, for people that are, cringing at the idea of providing pharmaceutical grade drugs to people who are using drugs, we have to remember too that not only promotes the health and well-being of people, but it also, and prevents their risk of overdose death, but it also reduces their need to rely on illegal activities to generate the vast amount of revenue required to purchase drugs on the illegal market. And it certainly will cut down on profits going to, organizations like transnational organizations that are benefiting from the multi-billion-dollar international drug trade.
Yeah, I mean, I think it's worth noting. I mean, when it comes to government ideology, and every government and every political leader and every party has its own ideology. Ideology itself is not an inherently devastating word. Sometimes the ideology can be devastating to some people, but I think it's safe to suggest, Elaine, like you just pointed out, that this is not a provincial government, I think, that would ever consider something like providing a safe supply. As a matter of fact, I can't think of anything that would be further from this government priorities. Back in March of 2018, Premier Jason Kenney, by way of a Facebook post, quote, "We absolutely need to show compassion for those suffering with addiction, and we need to help them get off drugs, but helping addicts inject poison into their bodies is not a long-term solution to the problem." Hakique, I can see you tense up as you hear me read that. This government has pulled funding from supervised consumption services, either ones that were inching toward opening or ones that were opening and operational, albeit some of them, dealing with some administrative problems. Certainly Lethbridge's Arches facility is one example. But I know that was a devastating funding withdrawal for many, many people. Hakique, Dr. Virani, where do you stand on that? I mean, I could tell you had a visceral reaction when I read that quote.
Yeah, it's heartbreaking to characterize an intervention, a public health intervention that has such great evidence, to characterize it as such, and to be so graphic about, to try and marginalize people who already are excluded and subjugated, to characterize them that way, it really hurts. Because we've seen how much of a benefit it is to have a non-judgmental group of people who can help somebody who uses drugs and has run into troubles with them. You watch the Queen's Gambit. If you've seen this show on Netflix, it's really interesting because the main character, Beth, she's 9 years old. She lives in an orphanage, and at this orphanage, the girls stand in a line every morning, and they're given a multivitamin and a tranquilizer in the morning. And one of the older girls tells her, you should try and save that for nighttime, which she did. And she preferred taking it at nighttime. So you'd get in trouble if you didn't take the tranquilizer in the morning as prescribed. And then what happened was the state stopped that practice. They said, you can't give these to the little girls anymore. So Beth broke into the little dispensary to try and get this drug. All that changed was the arbitrary rule changed, right? You can take this in the morning, you can't take this at night. You can take this when we give it to you, you can't take it when we don't give it to you. Well, the reason why it was wrong for Beth to use these drugs in the way that she was because she liked it, not because it was a different drug. And so I think it's pretty puritanical the way that we approach this, is that, okay, we'll prescribe you all sorts of drugs, but the moment you start to like what they do to you, we have to stop, because that's hedonic, right? And we can't allow that. If you like it, it's no good. Like heroin, for example, as far as pharmacology goes, fantastic drug. The amount that you need to take to get the intended effect is so much lower than the amount that you need to take to die. But because the intended effect was euphoria, we stopped using it. Bayer used to market this drug all over the place, but at the moment that people started to enjoy it, and especially the moment that poor people or racialized groups started to enjoy it, it became wrong. We have to confront the framework with which we think of these things to be able to understand what the position is of people who are just trying to access a different quality of life than we've given to them.
Yeah, and I think that that's really the role of public health here. Like we've seen really significant harms when drugs are solely in the illegal market and there's no control on who they're marketed to, what's in them, how aggressively they're promoted. Likewise, we've seen significant harm on the other end of the spectrum when they're commercially, promoted, and we've all heard about Purdue and now McKinsey and all these different corporations that profited significantly off connecting as many people as they could to opioids and then hopefully keeping them prescribed for as long as possible. Neither is an ideal model, and in public health, we would never support either. The point of public health is to recognize that it is likely extremely unrealistic and probably not even a good goal to try and prevent all substance use. We know that some people do derive benefits from whatever drug they're using, and we should be realistic and recognize that. And it's about understanding how can we regulate this activity, which has inherent risk, in a way that prevents as much harm as possible in the population and doesn't infringe unnecessarily on people's personal liberties and rights. And so I think when we talk about a public health approach to substance use, decriminalization fits in that perspective. Harm reduction, treatment, primary prevention, helping people to not develop, significant problems with drugs. And to do that effectively, it usually takes a fairly concerted investment at an early age. But we have the evidence to support those kinds of tools and interventions. And if governments were willing to allow a public health approach, to be adopted in this space, I think we would significantly cut down on the number of people dying, and we'd promote people's well-being, and we would reduce all of the host of negative health outcomes that come from, uncontrolled drugs on either end of the spectrum, whether it be legal or commercial.
It's so important.
I think that the other important point to make is, and those are, Elaine basically said in a smart way what I was trying to say, fumbling through. But I think that underlying all of this is that, drug use often reflects, in the groups that run into troubles with drug use, it reflects how opportunity and quality of life is distributed through our population. And we can try and trim around the edges of an overdose epidemic as much as we want, and there are some interventions that we know will make a difference, decrim, harm reduction approaches, and for many people, better access to addiction treatment when they've run into addiction troubles with their drugs. But ultimately, it's going to come down to what opportunities and quality of life can we afford as a society to people who we've pushed to the edges. And I think that's a question for how we respond to COVID. That's a question for how we respond to movements like Black Lives Matter. It's important for addressing truth and reconciliation and finally giving Indigenous people the rights they deserve. And it's the same with the overdose epidemic.
Dr. Hakique Virani is a clinical associate professor in the Faculty of Medicine at the University of Alberta, a specialist physician in public health, preventative medicine, and addiction medicine, a former medical officer of health for Health Canada for 10 years, including through the H1N1 influenza virus. And Dr. Elaine Hyshka, an amazing and remarkable assistant professor at the School of Public Health, University of Alberta. You can tell, can't you, friends tuned in, watching or listening to this right now, how much they give a damn about what we're talking about, how much they care about people, the human side of this conversation. I'm so grateful that the both of you gave us an hour of your time to have an exploratory and free-flowing and meaningful and focused conversation on public health policy in a number of different contexts. And I'm grateful. I know that every single one of us that was privileged enough to hear from you today learned something. And thank you so much for joining us, and I'll look forward to future and further conversation on this.
Thanks, Ryan.
I'm a huge fan of both of those two, and you can probably tell why. Give them a follow on Twitter at Hakique and at Hyshka, and we link to those every morning. I tweet out the guests that are going to be on the show, including my brother Kyle in just a second. I'm essentially just going to roll over into that interview and have Kyle pick up where those two left off, because he works on the front line of this when we talk about the opioid crisis, when we talk about people who use drugs, when we talk about the city of Vancouver. That's our focal point today. Vancouver Council's unanimous vote to decriminalize possession of drugs. It'll require cooperation from the feds on that, and we'll get Kyle's take on that, Kyle Jespersen, in just a moment. Want to thank the team at Local Waste for ensuring that each and every day we are bringing you real talk on this platform, weekdays from 8:30 all the way through. This is a team that understands the beauty and importance of local service delivery. For 25 years, Local Waste has been providing services right here in the Metro Edmonton region, going head-to-head against those big, faceless, multinational garbage corporations. Whether you're a little operation or way up one of those big ones, and waste removal is something you need to deal with, why not deal with somebody that gives you their first name and their phone number, like Chris and Lauren Labossiere have done at 780-242-9746. They want your business at Local Waste. You know, we're also now, of course, 24 days away from a pretty big day for those that'll be observing Christmas, whatever your family's holiday season looks like. If it includes a feast, I want to direct you toward the team, my friends at Friesen Brothers. They've got 15 locations almost open in Alberta. Beautiful South Edmonton store set to open in the spring. We love the locations and drive out to get our groceries in Fort Saskatchewan, Stony Plain. And I know that many of you that are listening in across the province of Alberta feel very strongly about your Friesen Brothers store, because every time I talk about them, you chime in and let me know what you love best from their Red Seal chefs. Well, that team of Red Seal chefs is set to go with turkeys, with all the fixins, including Alberta-grown produce. Why not leave your holiday meal planning and delivery to the Friesen Brothers? They'll make it all happen. You show up, you pick it up, and there you go. You're not sweating in the kitchen while everybody else in your immediate family unit is socializing. Friesen Brothers is Alberta-grown and Alberta-owned. Well, as mentioned, and I don't know if any of you put money down on which one of my family members was going to be first to appear here on Real Talk, but if you guessed my brother Kyle, I guess you're the big winner today. You're ultimately going to meet my dad, Bruce, who's a retired family physician. He's living with Parkinson's, which adds some interesting complexity to his perspective. My mom, a retired teacher and homemaker. My sister Megan, a counseling psychologist. My youngest brother, Jonas, grows cannabis for Joy Botanicals. But it's Kyle, my brother, that'll be making his debut first on Real Talk today. 7 years Kyle's been working ongoing in Vancouver's downtown east side in clinical, residential, and community settings with a focus on detox and harm reduction services. He's currently co-managing InSite supervised injection site, where he also served as a night coordinator for about 4 years through our ongoing tainted drug crisis. InSite, you may know, if you've been paying attention to this conversation, the model in Canada. It's been operating under federal exemption for 17 years. It's recorded literally millions of visits, thousands of referrals, and 0 deaths. Kyle, welcome to Real Talk. It's a real pleasure to have you here, brother.
It's a real pleasure for me too. Yeah, it's a real honor to close this year out. It's a new month, and wow, what a lot of reflection we have to do.
Yeah, so I know that you were paying attention to what the good doctors had to say right before you were here, and we're obviously talking about a city council vote, a unanimous vote that occurred last Wednesday in your home city, Vancouver, a motion from Vancouver's Mayor Kennedy Stewart to decriminalize small possession of small amounts of narcotics within Vancouver's city limits. Why is this significant through your eyes, through your perspective?
Well, every day I go to work and I come across the drug users in our city, the people who use drugs. And one of the great difficulties of coming into contact with them every day is knowing that when they step outside of the safety and protection of our clinic, that they are criminalized, and that at any moment they could get shook down, stopped, searched, arrested, abused. And this has been happening for many years, to the point that there's so much depression and demoralization amongst the community of people who use drugs that something needs to change. And this is that first sign that this is happening.
We talked, Dr. Hyshka, Dr. Virani talked about the hesitance and some of the perceived or real barriers, people who use drugs of interacting with healthcare delivery, with the healthcare system, whether that's reporting to ER, post overdose, or whether that's talking to a health counselor, whether that's a regular consultation, let alone an annual physical, whatever the case may be. InSite has obviously, like we said in your introduction, for coming up on 20 years, provided a window of sorts, provided an entry point, provided a contact point for people who use drugs, human beings, to make connections within the healthcare system. How does that work? I mean, you see it each and every day. How does it actually play out?
Yeah, this is a great question. It's important to understand that InSite is about so much more than just injection. It's about connection, really. It's about educating people. It's about education around injection techniques. And when you start to make that connection with people and meet them where they're at and reduce their harm and show them that you have no judgment around their current practices and their current self-soothing techniques, then they're going to be more open to hearing what you might have to say about accessing detox services or another type of treatment or recovery center, or putting in a housing application that could stabilize their life, or noticing that if we notice that they have abscesses or wounds that need some proper care because they're getting worse due to street entrenchment, that whole lifestyle. There's so many things that we can identify when we engage people where they're at that can lead to better health outcomes in so many ways.
So for people that are listening to this podcast later in the day, or people that are streaming us live, audio, watching on video, I mean, you have an audience obviously that's going to grow through the day here as people, hear this message. And I guarantee, Kyle, that a portion of the audience, an element of the audience is going to see eye to eye with politicians that would push back on the idea or the model of supervised consumption services, the idea that what we're doing is normalizing drug use, or we're endorsing drug use, or we're paving the way for people that don't use drugs to start experimenting with drugs because the barriers, legal or otherwise, have been removed. We're not gonna solve the problem. We're gonna perpetuate the drug use, and ultimately, I mean, you've heard this a million times. Speak directly to the people whose perspective might be that. Why is it important to reconsider?
Well, if we're not advocating for new systems, we're saying that we're fine with the old systems. And with the current old, outmoded, misguided, and frankly bad policy that we have right now, we're seeing continuing overdose deaths. We're seeing continuing sickness. We're seeing continuing poverty. We have to be fearless and be willing to change our minds. That's why I commend our city council, so there's so much hesitation around re-examining our beliefs on drug use and changing our drug policy. But we need to just give our heads a shake and realize that what we're doing is not working. And I can tell you that firsthand. I see that every single day. So it's very much about laying down our pride. It's about laying down our judgment and realizing that this is not a moral issue. It's a health issue. We can't attach morality to chemical compounds. Yeah, that's pretty much it. It's just about having the humility to understand that we can change things. And really, this drug policy that we're operating under now has only been in place for less than a century. It's not the way things need to be or should be. Well,
and it's totally arbitrary. Right? I mean, it's completely arbitrary. If you can allow yourself, I'm not talking you, Kyle, I'm talking as society, if we can allow ourselves to assume that there are no parameters in a conversation, right? And to start wondering why things like, tobacco is legal and alcohol is legal, but certain narcotics are illegal. If we actually do a deep dive into what has driven drug policy in the United States and in Canada and other countries, if we start to really look at this, and quite frankly, if we start to follow the money as well when it comes to where governments are investing and how governments are approaching, for example, the opioid crisis, I think that a lot of people might have these moments, these epiphanies where we realize that just because something has been the way it is, I mean, I love the way that you put it. If we're not willing to change, what we're alluding to or what we're accepting is that things are going well the way they are. And quite frankly, right now in Canada, you cannot make that assertion. When you take a look at, I mean, Andrea Woo, we talked to her from the Globe and Mail, Elaine Hyshka reiterating this. You have 5 people dying a day in British Columbia due to this. And we're not even, I hate to say it, I hate to put it this way, Kyle, I know you are in your line of work talking about it, and healthcare professionals are certainly talking about it, but this is off the general public's radar. I mean, like literally people will sit here and say, oh yeah, we do have the opioid crisis, but the word crisis should mean something. The word crisis should demand some sort of response, meaningful response.
Yeah, and I think that sometimes it does us a disservice to call this a crisis, because that seems to insinuate there's a start date and there's an end date, and it's something that, wow, we all managed to get through, and wow, remember that crisis. This is not so much a crisis as it is just an ongoing extended spiral due to bad drug policy. You're right, when you really get down to the brass tacks of it, to the science of it, substances mean different things for everybody's different neural pathways. And nowadays, drugs are becoming more and more chemical. So the way we've been trying to do things is stop it at the source. You know, you can investigate and put sanctions on Afghanistan for opium, or Colombia for cocaine. But now people are starting to manufacture fentanyl and other opioid analogs anywhere they can. It's getting harder and harder to enforce, and it's becoming less plant-based and more lab-based. It's just getting worse and worse. There's no way to stop it or mitigate it really under our current system.
So this is, you take a look at what InSite has accomplished, or what it's done over the 17 years and like you said, millions of visits, literally millions of visits from people, and 0 deaths. The observation that you'll see from some politicians, including here in Alberta, Kyle, is that, quote, or let me say paraphrased, all you need to do is take a look at Vancouver's East Hastings area to get a sense of what this looks like. In other words, taking InSite, right? And this is oftentimes used by the NIMBY crowd, where you open a supervised consumption site or policies in place by way of a development permit or public town hall forums, and people will say, well, I don't want that. I don't want people showing up to use drugs in my neighborhood. The crime's going to go up. There's going to be needles everywhere in our backyards. They're going to be breaking into vehicles. You only need to look at East Hastings to get a sense of what happens when you have supervised consumption sites. You've heard this thousands of times, I know, from detractors. What would it look like if InSite was not there?
Oh my gosh, what would Vancouver like if InSite? Sometimes I imagine back to the early 90s when my organization, PHS Community Services Society, started. There was virtually nothing for our people in the neighborhood at that time. And people were so sick, they were using puddle water in the alleys to inject. They had no options if they had horrible wounds or abscesses or internal conditions or blood diseases, or any of that stuff. I can't even imagine. It is bad right now. I mean, we're not trying to cover that up. Here's the situation in Vancouver. We take care of citizens from across the country. So when I hear other health ministers, other leaders from other provinces, and citizens too, deride Vancouver and say, we don't want what they're doing here. Well, guess what? We're taking care of your friends. We're taking care of your sisters, your brothers, your aunts, your uncles, your nieces, your nephews, etc. So I get really sick of this anti-Vancouver, anti-downtown East Side. No, we're setting an example, and we're taking care. There's harm being done. Yes, we're reducing it. If you're only going to give us that, that's all we're ever going to do. The harm's going to keep on happening, and we're going to keep on trying to reduce it. And it's pretty absurd and ridiculous. So let's kick in the other measures, and we can start sending some of these people back to their families and reconnecting them with work and life fulfillment. And then we can stop pointing a finger at this problem that really we've all created. and has just ended up here because this is one of the few corners of our country that's temperate enough for people to survive when they're sick and they don't have homes and they don't have any support systems.
You can tell if you're watching right now, you can tell if you're listening to this right now, how much my brother Kyle cares passionately about what he does. And your professional journey, Kyle, is interwoven with a personal journey. And it's been amazing to watch. And I'm so very proud of you. We're getting set to sign off here for the morning, but I want to ask you to leave us with something to walk with today, something to think about, something that may challenge our preconceived notions or our strong opinions on this matter. Give us something to put in front of our family and friends when conversation around supervised consumption or decriminalization policy or public health policy surfaces. And we want to have an informed and gutsy and sometimes uncomfortable conversation. Give us something to walk with and think about today.
That's a big question. Like I said earlier, it's about laying down our humility and having these conversations in a new way. I was at a playground recently, and one of the parents there used the J word. It's a pejorative term in reference to a person who uses drugs.
Right.
And they used this word in front of all the kids that were running and playing around us. The kids heard it. 3-year-olds heard it. My son heard it. And it was accepted. No other parents questioned it. I was the only guy who bristled. And I think that's a sign that we're really stuck in these judgmental ways of thinking. So make little changes in yourself. Stop using words and terms that oppress people who have deteriorating health conditions. Don't be afraid to ask people, hey, has drug use or drug policy or the tainted drug problem that we're having, has that affected your life? Ask these questions in a new way. Step outside your front door today and entertain the thought, hey, you know what? Drug use should not be illegal. And for people who use drugs, they should have access to medical support and pharmaceutical alternatives so they can stabilize their life and that we can all move forward and all progress and all contribute to society. Do the work internally. Start doing it in your social circles. Renew the phrasing you use and the conversations you'll have. It's a beautiful thing, and you will set yourself free, much like I have.
Yeah, you sure have. And I'm so proud of you. And I couldn't be more proud of you this morning. And I love you dearly. That Kyle Jespersen, my friends tuning in, my brother, obviously, who co-manages InSite supervised injection site in Vancouver's downtown east side. Thanks for making time for us this morning, brother. I know you'll be back on the show soon enough, and I look forward to it already.
Well, it's a real honor to talk on this topic at this time in history. So thank you, my brother. I'm really proud of you and your new show. It's just wonderful.
There you go. These are the types of conversations we want to have, the types of conversations we are having and will continue to have on this program. And I really appreciate Kyle's availability. I want to take a moment to recognize some of the partners that make conversations like these possible, because they're keeping our studio lights on. They're making sure that the live streaming keeps working. They're keeping us rolling into every morning with real talk, including the team at Westworld Computers. 40 years as a family-owned business. Your go-to for the Apple lineup in Western Canada, including Vancouver, Edmonton, Calgary. A personal relationship with customers is what they're most proud of. So whether it's an iPhone, the latest one you're looking for, or maybe you're looking for the sexiest desktop unit that you can find to power your new creative venture, make sure you talk to the team at Westworld Computers. And while you're out and about today and you're feeling that hunger, or maybe you just want to treat yourself, who does treats better than Dairy Queen? Nobody is the quick answer. And there's 6 locations in Northwest Edmonton and Sherwood Park that deserve your business, if for no other reason that they believe in and support what we're doing here. Michael and Mark co-own these locations independently and locally that employ local people. And as you, of course, find ways to adjust to this pandemic by hitting drive-thrus and using your favorite delivery apps, I ask you to consider the Dairy Queens of Northwest Edmonton and Sherwood Park. Sam Brooks, the producer of this show, it's all of a sudden 10:20. So, we've sort of said that the show will go until it goes. We don't have to cap off or cut off or stop short meaningful conversations. But what a day this has been with regards to pushing us out of our comfort zones on maybe some ideas or opinions we may have on the issue of people who use drugs and drug policy in Canada.
Yeah, but I mean, pushing people out of their comfort zones is the whole point of your show, isn't it? Like, I mean, that's what we're here to do, right? We're here to have real talk and real conversations. No, it's funny. I keep a notebook here, so I can note quotes that would be good for using highlight clips later and that kind of stuff. And I have like 2 pages from today's discussion.
Where are you finding the time to write down quotes in a notebook? Where are you? I barely have time to check my Twitter mentions, let alone top up a coffee. And here you are keeping the entire technical production going and making
the problem
notes.
with topping up coffees for me is the coffee maker's on the other side of the room, and I have to
move
crawl on the floor if I need to get another coffee while we're on the air.
I think we need to move the coffee maker. Can we go to our GoPro camera that I'm so excited about? Is that fired up right now? See, so people can see. Here's our studio setup here. Yeah. I'm so excited to have Jay Bigham's art here. Every time we go to this camera shot, I get excited.
So gorgeous.
But the coffee, you can't see it's in your bottom left hand corner if you're watching us right now.
Literally right underneath the camera.
Yeah, literally right underneath the camera, right beside the Real Talk studio beer fridge. And as you can see, there are obstacles in the way between Sam and the coffee maker. And the last thing I want to do is get you so annoyed because the coffee, you can see it. It's 12 to 14 feet away from you. You can see it, but you can't access it.
It's kind of funny. Every show I anticipate to get myself a coffee right before we go on air, and every show it's like I'm scrambling to get something ready or something like that. And this is the first show in 7 shows I've started with a full coffee at the beginning of it. So that's really nice.
All
but
right.
I mean, if you want me to circle back to our discussion today, I just there's so much to take away from that. I mean, hearing from your brother Kyle was heartbreaking to think about the people that are using that. I mean, InSite is a facility that works. We know it works. It's a model that needs to be exported all over the country, frankly, all over the world. Harm reduction is the way to go, and I'm so happy to see what Vancouver's doing.
One of the things I think and Doctors Hyshka and Virani also kind of alluded to this, though Kyle spelled it out, was the idea of how we apply ethics or morals to matters or policy or public conversations around drugs. In other words, if we clutch our pearls over something, then we demand that there be legislation around it. If we believe that to put it this way, if heroin's not for you, or if the idea of blowing rails at a party and using cocaine is appalling to you, then nobody should use it, right? If you know a story anecdotally of somebody that overdosed tragically and died, and I'm certainly not making light of that, then obviously you're potentially going to be in a position where you believe that you should impose or apply your perspective on an anecdotal scenario to federal drug policy. And I think that it's easier said than done to pull ourselves away from that. We are inclined as people to believe that if we feel strongly about something that potentially it should be legislated, but quite frankly, it's the most anti-conservative thing you can do to impose more legislation to meddle in other people's lives. But also, I think that government needs to do more based on public demand to provide supports for people who use drugs. And I hope that our conversations today with Andrea Woo and Dr. Hyshka, Dr. Virani, and my brother Kyle have provided some people with food for thought, so to speak, on this.
Yeah, I mean, drugs are icky and drug users are gross. And that's kind of what we've been taught for years and years and years. And I mean, I absolutely love that your brother referenced the J word about talking about people that use drugs, because that's entirely how we need to reframe the conversation. If a bunch of rich people throw a party and there's a giant pile of cocaine on the table, that's living large and that's high society.
Yeah.
You know what I mean? And people that are scraping by, relying on this substance that they're addicted to and hoping that they have a roof over their head the next night are people that we cast away. But these people are doing the same thing.
Yeah, I agree with you. I want to leave us on something light. This is a hard swerve from anything we've talked about today. Sam, you know exactly the video I'm talking about. I'm so excited about this. This is there was no point in today's show where it really would have fit without denigrating.
No, it's too good not to share.
It would have compromised the seriousness of the conversations we were having, but this is so good. So I want to dedicate this to one of our loyal audience members who's tuning in every single morning from Dominical in Costa Rica. So this one's going out to Lazi. And this video is absolutely remarkable. You may know the televangelist Kenneth Copeland. He's that guy that when Donald Trump lost the election back on November 3rd, he went in front of his congregation and he was kind of doing that maniacal laugh that went viral. Remember, he's like, everybody's telling us that Joe Biden won. Ha 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 ha. He kind of went on this weird kind of tangent. He's a big Trump guy anyway. So he's a preacher, and so he gets up on his television show. This is the guy, by the way, that has justified the use of all the private jets and everything. He's one of these guys, one of these televangelists. We all know them, right? And so he gets up and he's making demands. He's demanding using the power that he can channel, the higher power that he can channel. He's making demands to the pandemic, and it caught the attention of a metal guitarist. Yeah, that's right, a metal guitarist by the name of Andre Antunes. And so Andre Antunes, a huge talent who you can follow on YouTube, he's got his own YouTube channel, has decided to put a little metal behind preacher Kenneth Copeland. And the end result is this beautiful masterpiece. Let's roll it.
Because we have...
In the name of Jesus.
Oh, thank you.
Standing in the office of the prophet of God, I execute judgment on you, COVID-19. I execute judgment on you, Satan, you destroyer, you killer, you get out, you break your power, you get off this nation. I demand judgment on you. I demand a vaccination to come immediately.
All right.
I call you done. I call you gone. You come down.
Okay, so that, my friends, is how we will wrap Tuesday's show. That is televangelist Kenneth Copeland with Andre Antunes, the metal guitarist. Maybe the greatest thing you're going to see all week. We hope that it was worth sticking around until the wrap of this edition of Real Talk. We'll talk to you again tomorrow.